Hello. How many of you know about creative health? I certainly didn't when I was given a document in 2018. So what I want to do is talk about why creative health is important to us as a general population and what we've been doing at the University of Chester in the Faculty of Medicine, Health and Society. And in particular, I'm going to share some evaluation data we've got from our creative health placement. You will see there's lots of pictures I'm going to share as we go along. These have all been given permission to share, and it's part of our data collection from our research project. So, what is creative health? Well, it's a relatively new phenomenon in healthcare education, but it's not new per se. How many of you sing, or do a bit of artwork, or dance? That's all under the umbrella term of creative health. In the UK, we have the National Centre for Creative Health, and they define creative health as creative approaches and activities which have the benefits for individual health and well-being and can contribute to preventative health measures, management of long-term conditions, and recovery from illnesses. So as I've said, activities can include art, craft, dance, film, literature, cooking, and even gardening. And what's important in this definition, it also talks about how, as healthcare services and educational professions, we need to act to manage and make sure people understand about creative health. Last year, in 2013, the National Centre for Creative Health did a review, and in that review they said that creative health is fundamental to healthy and prosperous society and should be an integral part of our 21st century health and social care system. It's not just in the UK that promote creative health. The World Health Organization also say that the use of artistic media in healthcare and in communities can have a wide variety of benefits for health outcomes. So why is creative health so important now? Well, our National Health Service is under great demand, and it's actually been proven that 1 in 5 GP appointments are for social reasons. And what's important is in our NHS long-term plan, they talk about social prescribing, where people might get an arts on prescription to go and do an activity which reduces loneliness, puts people in groups together, and has the benefits of well-being. And there is some research to show that an arts on prescription service had a 37% drop in GP consultation rates and a 37% drop in hospital admissions. They're vital to an already pressured service. There is a lot of evidence out there if you did some research about the benefits of creative health, and I can't talk about that in 15 minutes, but I'm just going to give you some examples. So it can improve the quality of life for an individual. It can aid healthy aging, it can reduce loneliness, it can promote self-esteem. There are just a few examples I'm going to pick out which relate to where I'm going to go now. So for postnatal depression, there was a research study on singing, and it showed that the women who partaked in singing actually had better improvements in their well-being quicker than those that took a medicalised approach. It's been shown with children with specific needs that actually music helps them with verbal communication, their social interaction, and their behaviour. At Alder Hay, which is just down the road from us at Chester, somatic dance was shown to improve pain in children post-op, and it actually showed that they do reduce their anxiety and actually increase movement. It's also been seen to be a host of long-term conditions, so from Parkinson's disease to stroke to respiratory disease to cardiovascular, all have better health outcomes partaking in some form of creative health activity. And also in the end-of-life arena in palliative care, it's been shown to help people accept their prognosis and prepare for death, but it's also been shown to help those families and carers around them to accept that day and give them a legacy afterwards. So that's the sort of context about creative health. So in 2017, the National Centre for Creative Health made some recommendations, and that's where my part in this journey started. That it said that we recommend that the education of clinicians, public health specialists and other health and social care professionals include accredited modules on the evidence-based and practical use of the arts for health and well-being. More recently, last year, they also said that opportunities to gain skills and qualifications in creative health should be available in higher education and as part of medical and healthcare training. So at Chester then, we've roughly got 450 nursing students who start every year across 4 academic sites and across all 4 fields of nursing, so that's adult, children's, learning disability and mental health. So when I rewrote the nursing curriculum with my colleagues, we actually put a programme aim in about creative health, so it was embedded in our philosophy and our practice. So to develop an understanding of the practical experience of the arts in varying health and social care environments. We also made sure it was in our learning and teaching philosophy, and in particular about our simulation, which is where I'm going to talk now. So in 2022, we developed creative health placements. We worked with the Philip Barker Centre for Creative Learning, and 60 first-year students undertook this placement. In 2023, and then this year, we've expanded it to all our first-year student nurses. We used the NHS England's education tariff to help pay for the artists and to meet our regulatory requirements from the Nurse Midwifery Council. We invited members of the public to come in and experience this offer, and we also evaluated it. The placement now is 4 weeks, and they work with 2 dominant artists a week, usually music, type and some art-based activities, but we also give them tasters in lots of other things, including dance. They have a formalised social prescribing visit so they can see what they're using in simulation out in practice, and they have time for critical reflection and with their practice assessor and supervisor. So this is a picture of a poster that one of our pilot students designed. There was a lot of uncertainty, and this student who designed that poster talked about the fact that they had to jump in feet first and be open to new ideas, but they said that the time spent on social prescribing helped them to put the pieces into context, and they felt the benefits at the end of the placement. However, as their peers are on really nice, what I would call sexy nursing placements, where they could do blood pressures and all the exciting nursing skills, they did feel a bit disadvantaged. So the data is quite interesting. So 100% said they didn't feel prepared for the placement. 100% they were unsure about facilitating a creative health activity, but 83% were by the end of the placement. 67% said that they appreciated how creative health could influence their nursing practice, and also 66% felt that creative health should be a placement for all students. These pictures I'm just going to show you on the next 2 slides are what the students drew of their journey. So you can see that, oh my goodness, what have they given me as a placement? And then they went through this journey. It was challenging, they were confused, but at the end, they really did appreciate it. And this is just another one. So again, they were annoyed and confused. You can see that brain exploding with all the information. But they moved from an understanding to optimism. And I quite like this quote. Though I felt apprehensive at the start, I can now see the importance of creative health and how, as modern-day nurses, we can possibly impact the way nursing is done. I was amazed how it was on my doorstep. So really, they went through a transitional journey. There were quite a lot of challenges. Students said they dreaded the placement. They couldn't see why they were doing it, but at the end, they really felt that they'd seen the importance of person-centred care. And that's really important if you want someone to look after you holistically. You want the nurse to see every aspect of you, not just one physical aspect. They found that access to social prescribing quite challenging, and I'll talk about that. And some days, because we invited members of the public, not everybody came, so there was a challenge of that. We also took feedback from the artists we work with, and some of their feedback was that they loved the placement, they loved the concept, but they wanted to understand more about nursing and why it was important. And we also took feedback from the practice assessors and supervisors who were registrants themselves, and they talked about wanting to work with the artists and have a more generalised experience. So that influenced where we went with our 2023 placements. What was interesting throughout this journey is that the students reported how doing the placement had improved their own well-being as well, and we're actually measuring in that at the moment. They talked about it, that actually undertaking the placement was beneficial for their well-being, it was great for self-growth, and we started to measure last year pre and post anxiety and stress when they were doing the singing activities, and we found from the beginning to the end of the session in one day there was a reduction in stress, and also during the course of the placement, so we're now formalising that more. We also took service user feedback, so members of the public came in and undertook the activities. 98% they would come again, 98% said they were happy, and 100% said they felt better after the activity. And they said it was very therapeutic. I liked making the box to express my feelings. The group were very welcoming, and they felt much better than before. So that was a really positive outcome for the general population as well from us. So the main study, we asked the same questions, and now 86% agreed that creative health had helped them appreciate how they could influence their nursing practice. 92% agreed that social prescribing had increased their knowledge of health and wellbeing interventions, and 78% agreed that their perceptions of a typical nursing placement had been challenged. There's more data, but I'll just give you those as examples. And actually that is an improvement from the pilot, so we're heading in the right direction. We also asked them 3 things that they had learned during the placement. They talked about communication skills, the ability to express themselves through art, the impact of creative health and social prescribing on their practice, the importance then of giving holistic nursing, and the benefit to health and well-being. And I'll just read some students' reflections. Overall, I have really enjoyed this placement. It's opened my eyes to creative health and the alternative forms of therapy for people. I feel I have now grown in regard to my skills, such as alternative forms of communication, self-reflection, and awareness of mental health. Overall, the experience of creative health has been eye-opening. It has changed the way I will deliver healthcare. They also talked about the impact of going to their social prescribing placement. And one student said, this week at my spoke, I had the opportunity to lead a session with my regular patient. I was able to be able to follow her journey. This gave me a great sense of accomplishment and was very empowering. So we can really see the impact that what we've been doing has made for those students. So what we have learned as a team, having the university as a simulated placement is quite challenging. They're not going to a clinical area or a community placement. So we've had to work really hard about making them understand that when they're in university for the creative health placement, they are on placement, not in, just attending university as a student. We themed our days. So now we're trying to link it to their field of nursing. So we theme it for dementia and music, or singing and mother and baby. We formalised the spoke visits, so they have a set day each week which we give them, that they go out to a social prescribing visit. Because you remember that statistic, 100% said they felt they weren't prepared for the placement. We've done a lot about placement preparation, what is creative health within the curriculum before they get there. We are now looking about, from that self-wellbeing and home improvement, it's really important that nurses can be resilient and look after their own health. So we're looking now about how we can embed creative health beyond the placement and the rest of their programme. We're really pleased that the students can see the value of holistic nursing care and why a non-medicalised approach is just as important as a medicalised approach. They've really been able to improve their communication skills and networking skills and improve their reflective skills. And they can see now the impact that this learning has had on their future placements. So that is me and our journey for creative health. I hope I might have just given you a taste of what creative health is, and perhaps convinced you to go forward now and think about what you can do to enhance your own well-being. Can you join a community choir? Do you just need to take up some art-based activity? But all this has beneficial well-being effects for your health. So thank you very much.